Dear students, good evening. I'm Sarah. So this is my first video. I'm going to take about nursing management. So in future, I'm going to cover nursing research, nursing management, nursing foundation as well MSN 1 and MSN 2. So if you need any videos regarding these topics which I have mentioned, so please let me know. So can we go for the topic? So today we'll see about nursing management. In the nursing management, especially I just cover that INC syllabus, especially for third semester. So in that first unit of nursing management is healthcare development of nursing service in India. So we'll see about the nursing management. After that we'll see about the nursing services. Okay. See, nursing management in the sense, first you have to know about nursing management, right? See, nursing management means, see, if you're working as a nurse, we can work in hospital as well as the college. See, if we are working in the hospital, then nursing superintendent is maybe a nurse manager. Or if we are working in the college, the principal is a nurse manager. So what they are doing and what may be the work of the nurse manager, we'll see about. Okay. See, nursing management is a body of knowledge related to performing a functions of planning, organizing, staffing, directing, controlling the activities of nurses in various departments. In sense, see, as a nurse manager, so the main definition of nursing management is body of knowledge, and the main functions of nursing management is planning, organizing, and then staffing, controlling, and directing. Oh, so these are the various work we have to do as a nurse manager. So they are planning the work, how we have to work, like that they are planning, and they will organizing the way how to work, like that they are organizing the work, and they are giving a staffing pattern. Maybe if you are working in the college, then if you are working in the hospital, according to the NABH rule, they have given the staffing pattern. For if you're maybe in your if you're in the ICU, then the 1:1 or maybe 1:2 the patient ratio, then staff patient ratio. And if you're working in the ward, maybe for 1:4 or maybe 1:6 for the staff patient ratio. Okay, for one particular staff, they used to get a 6 number of patients in the general ward and all. But if you are working in ICU, then you may get a reduced number of patients. If you are dealing with the ventilator cases, then 1:1 is a staffing pattern. So according to the NABH rule, we used to get the staffing pattern. So as a nurse manager, they are organizing, they are planning, and they have given the staffing pattern, and then they are directing and controlling of all the work in various departments of all nurses. So this is called as a nursing management. So nursing management means, as a nurse manager, they have to plan, organize, and give the staffing pattern, as well as control, then directing and controlling of all the nurses in a various department. This is called as a nursing management. So we'll say about the nursing service. See, nursing service means it is one of the part of health organization. Nurse, without nurse, we can't do anything in the healthcare delivery, right? So we'll say the definition of nursing service. It is the part of the total health organization, and the main aim of nursing service is provide promotion of health and prevention of disease. This is the main aim of nursing service. So as a nurse, the main definition of nursing service is we are the part of a total health organization, and the main aim of nursing service is promotion of health, prevention of disease. This is called as a nursing service. So nursing management means we are planning, organizing, staffing, controlling, and directing and controlling of all the activities of nurses in various departments. What is nursing service? Nursing service means, so it is the total part of the health organization, and the main aim of nursing service is promotion of health, prevention of disease. So this is the two different definitions of nursing management. and nursing service. Then we will go for the categories. What are the categories in the healthcare delivery system of nursing service? We'll see. See, the first one is Global Health Agency, Global Health Policy and Public Health Policy, then Healthcare Services Policy, Insurance Policy, Breastfeeding Promotion Policy, etc. See, I'll explain one by one. First one is a Global Health Policy, which means we'll cover especially if any pandemic or any outbreak is happening, means we will do service through Global Health Policy. So global means entire the world, right? So out of our country. Then we will concentrate the risk factors or maybe any outbreaks or pandemics. So this if we are facing these situations, this policy will help to do a nursing service. And next one is a public health policy. So public health policy is a state level. So we have a two different kind of policy which is made by our government that I have mentioned here, Janani Shishu Suraksha and Rashtriya Bal Shasta. So these two different kind of health policy which is made by our government, then we are doing now. Okay, so through that we are providing a healthcare services for the patients. And then next one is the healthcare services policy. So healthcare services policy in the sense, here we are doing a primary, secondary and tertiary care, especially private as well as government sector policies which is included in this. Then insurance policy. So we all know about insurance policy, right? So through the insurance we have covered all the, which means we are providing many care for the patients without cost, which means in the free of cost we are doing so many care for the patients. So as a nurse we have to explore all those things to the patients, then it will be very helping for them, right? Then next one is the breastfeeding promotion policy. Through this policy we are educating the persons, we are educating the mothers, then to improve the newborn care. Okay, so these are the policies which is made by our government, and so through this we are providing our nursing services. Then we'll see why we are doing these all the things. We will see the main objectives of nursing services. So the first important objective is encourage the nurse personnel to participate. So main object, we have to encourage the nurses to participating in various health policy. Then why we have to do this means, then only we can get the chance to give a voice, right? Then we should perform a nursing audit. See, nursing audit means, I'll give some examples. See, if you are working in the hospital, then as a nursing superintendent maybe come for the rounds, right? Why they have to come as a nurse manager or maybe a nursing superintendent or maybe a deputy nursing superintendent or infection control nurse in charge or nurse educator, they used to come for a rounds. Why they are coming means, because they want to assess your performance, right? So this is the way, according to the NABH, monthly once we have to conduct a nursing audit in each and every department, which means each and every ward. So they are specifically, they are assessing the staffing performance, how they are providing a quality of care, like that they are assessing and they are documenting. Okay, so why we are doing this? To improve the quality of nursing care. Clear? Then development clinical guidelines. So as per the hospital policy, we have to develop some clinical guidelines. Why means to improve the patient care. Clear? Then provide a qualitative as well as comprehensive care. See, we have to provide a quality of nursing care as well. We should concentrate the comprehensive care. What is mean by comprehensive? See, comprehensive in the sense, we have to provide a care physically, mentally, as which means as well as we should concentrate physical and emotional care, which means we have to concentrate patients. We should show our empathy towards a patient. Okay, so then next one is a apply a problem solving approach. Problem solving means, see, if you found any problem, like if you are assessing, if you have conducted a nursing audit, then you are assessing that your staffs are having a deficit knowledge of CPR. So as soon as possible, you should arrange a solution, which means you are arranging a training program for your staffs, and you are improving, you are getting, you are make developments, right? So this is called as a problem solving approach. When you found that any one kind of problem, as soon as possible, you are providing the solution. Then next one is a promote evidence-based practice. See, evidence-based practice means, if you found any problem, you have to find a solution through the research. Okay, so you should conduct a mini research. Then according to the research, you have to provide the solution. This is called as a evidence-based practice. And you should conduct a regular research to strengthen the service. Why we are conducting research means to strengthen our nursing service. So these are the objectives which is made by nursing services. So till now we have seen definitions of nursing management and nursing service, then categories of nursing service and objectives. So remaining things we'll see in the next video. So if you want to talk to me, you can comment me on the chat box. Okay, thank you all. Bye bye.